Welcome to our exploration of diabetes mellitus and hypoglycemia, where we'll delve into glucose homeostasis, lab diagnosis, complications, and clinical interpretation. Understanding glucose homeostasis is crucial as it regulates blood glucose levels. The liver plays a key role in managing glucose during fed and fasting states. Insulin is the only hormone that lowers blood glucose, while others like glucagon and adrenaline raise it, highlighting the balance in hormonal regulation. Insulin biosynthesis involves several steps from pre-proinsulin to secretion, with stimuli like glucose and incretin effect enhancing secretion. C-peptide is critical in distinguishing endogenous insulin production from external sources, making it vital for clinical assessments. Let's transition into Section 2, focusing on diabetes mellitus. Type 1 and Type 2 diabetes differ in mechanisms, insulin needs, and associated conditions, providing a comprehensive comparison. We now move to Section 3, where we will discuss the lab diagnosis of diabetes. Diagnostic thresholds for diabetes are based on venous plasma glucose levels, with specific values indicating normal, pre-diabetes, or diabetes mellitus. HbA1c reflects average blood glucose over time, serving as a key indicator for diabetes diagnosis and management. Certain conditions can cause errors in HbA1c results, making it crucial to understand these limitations for accurate diagnosis. Impaired fasting. Glucose and impaired glucose tolerance are pre-diabetic states with distinct characteristics and risks. We now enter Section 4, focusing on metabolic complications associated with diabetes. Diabetic ketoacidosis involves a biochemical cascade leading to severe metabolic disturbances, emphasizing the domino effect in its progression. Interpreting blood results in DKA is critical for effective management, with specific findings guiding clinical decisions. Comparing DKA and HHS reveals differences in onset, severity, and mortality, highlighting the unique challenges of each condition. We now transition to Section 5, where we will explore hypoglycemia. Hypoglycemia is defined by low blood glucose levels, with various causes ranging from excess insulin to drug interactions. Insulinoma and hypoglycemia lab interpretation involve assessing insulin and C-peptide levels to determine the underlying cause. Finally, we introduce Topic 2, focusing on iron metabolism, porphyrias, and abnormal hemoglobin. Iron in the body is primarily stored in hemoglobin, making up 65 to 70% of total iron. Ferritin and hemosiderin account for 20 to 30%, stored in the liver, spleen, and bone marrow. A smaller portion, 3–5%, is found in muscle as myoglobin. Understanding these distributions is crucial for diagnosing iron-related conditions. Iron absorption is a complex process influenced by various factors. Depleted iron levels increase absorption, while overload decreases it. Ascorbic acid enhances absorption, whereas certain foods and medications can inhibit it. Understanding these mechanisms helps in managing iron intake effectively. 4 core iron tests provide essential insights. Serum iron measures iron bound to transferrin. Serum ferritin indicates storage levels. T-binding. Transferrin saturation reflects iron binding capacity. Serum transferrin receptor helps assess iron deficiency. Each test offers unique diagnostic value. Mastering the iron panel pattern recognition table is crucial for diagnosing iron disorders. Each condition presents unique patterns in serum iron, ferritin, TIBC, and saturation levels. Recognizing these patterns aids in accurate diagnosis and treatment planning. Iron deficiency in chronic disease presents a diagnostic challenge. Inflammation can mask true iron deficiency by affecting ferritin levels. Understanding the interplay between ferritin, TIBC and transfer in saturation is key to accurate diagnosis. Investigating iron deficiency requires identifying the underlying cause. Decreased intake, malabsorption, increased requirements, and excessive losses are key areas to explore. Each factor provides clues to the root cause of deficiency. High-yield reminders for exams include understanding insulin's role in glucose regulation, recognizing symptoms of iron deficiency, and knowing the implications of various test results. These insights are crucial for effective diagnosis and treatment.